It's very common that mothers who have postnatal depression have very troubling thoughts about harming their baby, thoughts that can often come into their head even though they try and resist them. It's important to recognise that they're common, but mothers rarely act on those thoughts. But if you do find you're having thoughts like that, it's a signal that you need to talk to somebody else about your problem and not be worried that they'll judge you. Health visitors and other doctors recognise that these thoughts can occur. Another concern, of course, is that when people feel very low, they have thoughts that sometimes they're a very bad mother. They wish they just didn't wake up tomorrow, and that can go as far as wishing that they were better off dead as well. And again, if you're having thoughts like that as a new mother, it's a signal that it's time to seek help. I remember one mum with postnatal depression who said very vividly to me, here I have a new baby and I should be very happy to see this baby, but he's completely dependent on me. He needs all my loving, and I didn't get that loving, I don't think, when I was a child. And of course having a new baby raised all those issues for her about her own childhood, and that would be true for most of us when we become parents. And as well, mums are going to have to take on new roles. They might have had to give up a job or take time out of work, and they find that their new job is now being a mother. And going to work gives us a lot of sort of social support and contact, and sometimes being at home, some mothers find, can be quite isolating. If people say it didn't happen in my day, my guess it was probably there, but it was something that people didn't recognise or they didn't talk about. And now health visitors, doctors like myself, are being trained to look out for postnatal depression because we recognise some of the severe consequences it can have without treatment. There are two main options for treatment. One are talking therapies like counselling or psychotherapy, and the other is antidepressant medication. And for mothers who have, or for most mothers who have postnatal depression, either of those are equally good, and both of them together can be helpful.